our estrogen is like 1,000 times more than what it is normally.
Welcome to Cycle Wisdom Chats, where we explore the world of fertility awareness, hormonal health, and womb care from both a scientific and energetic lens. I'm Mary Aline, your certified fertility awareness educator, and in this episode, I'm super excited to introduce you to Ashley Goodwin, who is the owner of the Hippie Martha. Ashley's also a nurse and a certified fertility awareness educator. Welcome, Ashley. Thank you so much for joining me today.
Yes, thank you so much for having me. I'm so excited to be here.
Postpartum can be such a roller coaster of hormones, especially if you are breast or chest feeding, because then there's like another layer there. So, what are some of the common hormonal shifts that people may experience within the first weeks through the first months post birth?
Yeah, so there are so many different changes. And I guess let's start during pregnancy. Our estrogen is like 1,000 times more than what it is normally. It helps with promoting breast growth, softening the cervix, blood flow to the uterus. It provides so much for a mother. So when a mother reaches this full term, estrogen levels are super, super high. So you're going to be feeling a lot of things. And then after delivery, we see a huge decline in estrogen, and this
Mm,
really can affect it. And for first time moms, you've never experienced this. And so it
yeah.
can be a sudden like hit to everything, to our emotions, to our body. I think it's roughly 80% of mothers have postpartum blues due to this lack of estrogen. If the mother continues to chest feed or breastfeed throughout that time, then our estrogen is also going to be suppressed because we are using different hormones during this time, which is our lactational hormones. So that's just estrogen. Yes, there's this huge hormonal shift, but our bodies are super, super smart and they know what to do, which brings me to kind of, what happens afterwards. So obviously, progesterone is the pregnancy hormone. During pregnancy, progesterone is really high. That too also drops off after the placenta is delivered. 3 to 6 weeks postpartum, you are not going to be ovulating. Your body just underwent a lot of hormonal changes, and you have roughly like 59 days before you even have to worry about ovulation. Progesterone doesn't come back until we ovulate, right? So
Mhm.
we have to kind of understand that, yeah, we might get the loss of progesterone. During pregnancy, cortisol is 2 to 4 times higher than pre pregnancy levels.
Wow.
And this hormone really helps to shape our baby's developing nervous system, regulating things like mental development and temperament. And after pregnancy, these high levels of cortisol pass into the breast milk that help to influence kind of your baby's mood, stimulation, and it helps to keep you alert as a mother who's probably suffering from a little bit of fatigue, right? The other thing is oxytocin. Oxytocin helps us to go into labor. It helps our uterus to contract. Cervix, will then dilate. Then afterwards, oxytocin is that big love hormone and it just gushes. And so it really acts as like a dopamine trigger to help with the loss of estrogen and the loss
Mm,
of progesterone. Those who, have disruptions or who have had maybe a rough delivery, or those who don't want to nurse or chest feed, then that's when sometimes it could be a harder transition because a lot of those hormones might not be as strong.
hmm. Yeah, and so from my understanding too, is the suckling of the baby at the breast through the chest is what stimulates the release of prolactin and oxytocin.
Prolactin makes the milk and oxytocin releases the milk. This whole feedback loop is done from the brain into the breast. Even just putting your baby skin to skin can release oxytocin. So even if you decide you don't want to breastfeed, I highly recommend skin to skin, really smelling your baby, getting all those good vibes, cuddles, can really help with that shift.
I have a little bit of a more edgy question around people that choose to ingest their placenta after birth. Could that be helpful for the birthing parent in terms of hormonal balance?
The research doesn't support a lot of it because there can be a lot of other bacteria that can be exposed to the placenta based on how it was cared for, how it was dried, if it was
Mm,
frozen right away, like how was it taken care of prior to it becoming encapsulated. I have had lots of women who have done it, and some have said, yes, it helped. Some have actually felt that it caused more of anxiety and depression. I think the placenta is a sacred thing. And so I think using it in a way that you feel comfortable is welcome. You deliver in the hospital. That just has to be in a bloodborne transport bag, and we just ask that it gets taken care of within the hour of being delivered, because really you can get a lot of sickness if it's not like frozen right away.
if you are finding value from this video, please hit the like button, comment below. Let's jump into cycle tracking, cycle mapping, fertility awareness during postpartum. And to be clear, Ashley and I both teach the symptothermal method of fertility awareness. What's one of the most confusing parts of tracking return of fertility postpartum?
Obviously, we're going to have a time of stillness where our ovaries are dormant, and this is the time that you really just want to get that oxytocin love from your baby, snuggling with your baby, enjoying, resting, nourishing, getting, doing what you can just to just exist and not have to worry about a darn thing.
Yeah.
Like it really, though, in that time of stillness is we're constantly forgetting that. After that time of stillness, that's when our ovaries start to wake up. And you might notice different waves of fertility. So you might notice estrogen starting to come through. You might have more energy. You might actually ovulate one time and then not ovulate for another couple months. So that's kind of when your body is starting to wake up. And that's when that first period will happen. And then after that is the time of transition. So we have this time that we see where we're ovulating a little bit more regularly, but it's still irregular. So you might
Yeah.
have longer cycles. You might have a really short cycle where your body's like, okay, estrogen's high enough. Let's ovulate really quick, right?
Mhm.
Um, and then finally, maybe after a year or two, depending on how long, if you've decided to breastfeed, or if maybe have a lot of, maybe you weren't nourished enough, or maybe,
Mhm.
your adrenals or your thyroid are struggling due to stress
Yeah.
or sleep or whatever it is. It could take up to 2 to 4 years for that cycle to return completely back to normal.
Yeah, I think
So
that is so important to share
yeah.
that this postpartum time can last for a long time. And just I think to set that precedence and to set that expectation for new parents and to normalize that this is a normal part of this transition.
When you look at a return of fertility, the biggest thing I tell my clients is to pay attention to waves of cervical fluid, of noticing if they are having the sexual desire. Are they noticing a shift in basal body temperature? Are they able to keep, an extended period of time of the luteal phase? It can be difficult to get a BBT when your baby's up all night, right? It can be
Yeah.
difficult to look at your cervical fluid during when you're going to the bathroom when you have a baby crying in the other room, or you have other little ones running around, right? So creating a sustainable practice prior to having a baby can be really helpful. and going into it knowing that it doesn't have to look perfect, that you just have to
Mm.
know these different signs of fertility. Also, remember that ovulation occurs before the first period. So,
Yes,
a lot,
so
this is where
important.
this is where a lot of unintended pregnancies come from.
At what point do you recommend including basal body temperature into the postpartum tracking or cycle tracking practice?
Are you seeing cervical fluid again? Are you seeing like little waves of cervical fluid? That's a good indicator to say, okay, maybe I should start tracking a little bit better.
What are your thoughts on wearable devices during this time?
Yeah. So I think, once again, another individualized postpartum is so like you can't just like put a whole like bundle around it, you know? You have to really look at the individual person and understand what their desires are and what they want and what they can afford. And so yeah, if they can afford a wearable such as like a temp drop, I recommend doing it. If that's going to help them be more consistent with their charting,
Mhm.
absolutely.
I've had a few postpartum clients that have used the temp drop and have been really successful because it's allowing them to wake up in the middle of the night, nurse their baby, go back to sleep for an hour, wake up again, and
Yeah.
still get a temperature read. But yeah, I think just that in consent, like informed consent around knowing that it's not exactly the gold standard of a core oral temp first thing in the morning is also important to
Mhm.
share with people.
Yeah. And
Um,
like later down the road, I have noticed, especially on the charts that I've seen, um, those who even still get woken up, but they take their temperature, like let's say they have like a 3 hour span of sleep, I'm still having them take their temperatures and their oral temperatures are actually accurate, you know? So
yeah,
I feel like you kind of got to see how it's going based on, how their charts look. And
totally. Like,
working with a fertility awareness educator can be super helpful during this time.
yeah, I agree. Working with an educator during this time can decrease some of the stress and anxiety and answer some of those like more specific questions of like how can we make this sustainable for you, helping you decide, do I need a wearable, do I need just a regular pharmacy BBT thermometer? What's one thing you wish every postpartum person knew about their cycle or fertility?
Don't rush it. Like, why are we?
Mm,
I get that we want to kind of get back to ourselves, but we truly never will. After pregnancy, we all have this idea that we just don't want to be, we aren't pregnant anymore. We want to get back to normal. It's like this culture that we live in. And in reality, it's 9 months in, at least 9 months out. Honestly, I think it's 5 years out before you actually find what your true identity is after having a baby. We talk about balancing our hormones, but if we're nursing, our hormones aren't going to be balanced. And that's
yeah.
just the life of postpartum.
Thank you so much, Ashley.
Yeah.
That's great. Just everyday advice, I think, not just for
Right?
postpartum. I'm like, yeah, I needed to hear that today. I know you mentioned that you have a postpartum course available. Can you talk a little bit more about that and also just how people can connect with you?
On my website, thehippimartha.com, I have courses available. I also have a full postpartum cycle mapping course that teaches you how to chart your cycles in the postpartum phase.
Beautiful, beautiful. Thank you so much, Ashley, for putting this work out into the world. And I feel really grateful to have you as a colleague and another educator in this professional community because you bring so much to the table. So thank you so much for joining me today.
Thank
And
you.
I will link all of Ashley's offering in the show notes so you can check them out there.